My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back to this edition of the Heavily Meddled Podcast. Today, we are talking about all things adverse event reporting. I have not reported my own adverse events when it comes to my reactivity to my surgical and medical implants. And I've now had 42 surgeries with 8 surgeries to remove hardware. I am way overdue in filing this and screaming to the FDA on all of our collective behalves. So won't you join me in filing your adverse event report today? Let's talk about how to do that. We're also going to have special guest, our friend and metal allergy expert, Dr. Scott Schroeder, who's a retired foot and ankle surgeon, coming back to tell us a little bit about how to obtain your operative report, how to obtain your implant log from your surgery, how to read that implant log and determine the serial number, the device, the manufacturer, and all that good information so you have that information for your report. And he's going to talk about why surgeons may not want to remove hardware and how you can approach the surgeon when you want your hardware removed. There are some people that are having a lot of trouble with this. And he's also going to talk to, does it help to remove some of it if you've still got a lot in your body, and what his experience has been. So we'll look forward to that segment here in this great episode. I'm also going to show you what that implant log looks like and how to determine the material composition in that surgical implant. We talked a little bit about that at the end of episode 27, which is the episode I did with orthopedic analysis on the orthopedic analysis testing. I did go into that there. I'm going to recap it here. But if you haven't seen that episode, go watch it because there's a great little segment there with Dr. Marco Caicedo, who's the immunologist on staff at Orthopedic Analysis. He talks about some of these things that we see with the metal allergy testing and the implants, and does our body react to nickel all the time, or are we cross-reactive to other metals, and how is that showing up in our testing? So it's a really good episode. Again, I will reprise some of that here just so it's all in a convenient place. So let's go get into all these segments right now. We're going to assume that you've obtained your operative report, which you can get by calling your hospital or your surgeon's office. They should be able to provide you the operative report from your surgery, and you're going to be able to read down that operative report and see what was left in your body and see how the surgery went. You might find some things you don't want to know, but that's how a lot of people are finding out they have surgical clips from their gallbladder and other surgeries. But anyway, you've got several things. Your operative report is one thing. Then you're going to have a pick list, which is basically an equipment list of the tools and things that were used in your surgery. So you'll be able to look at that. That is most likely obtained from the hospital. It was in my case. So once I got the operative report from my surgeon, and again, the hospital can furnish that as well. Some of these places may have different protocols in place and direct you where to go for obtaining these different pieces of information. But your operative report's the first piece you need. Second piece is going to be your pick list or equipment that was used in your surgery. Right there, it may say Ethicon surgical clips or staples, and you'll be able to see that in that pick list of things that were used in your surgery. And then if you have a medical device or an implant like a tendon anchor or a cervical cage or screws or plates, you're going to have an implant log. These hospitals are required to have that for your surgery. This was my first spinal surgery, and these are all the implants that we're looking at with my first spinal surgery right here. So we have the plates and we have the screws and this hardware that anchored them. I have a lumbar fusion cage here. Also, this is an anterior screw and washer that came in from the front. You can see the screw there, the washer there. These implants we'll talk about later. These are my SI joint implants on both sides. Pretty big, gnarly things. Those are cages. They can't come out. I will tell you, though, that I did have less reactivity to this hardware once the bone fused around these cages. So there was that. That may give you some hope if you can't have these taken out. And what I did have taken out in this first surgery was these screws, these plates right here. So that was what it looked like prior to the removal surgery. Let me show you the after. This is what it looked like after I had those plates and screws removed. Remember all those that were right here that were super gnarly? So this is what it looked like after those were removed. And this is the surgery that we're going to be talking about. So here is the implant log from that surgery. And you can see that this was back in October of 2014. Here's what my implant log looks like. So you can see that this is a screw, this is a washer, and this is the cage. So that anterior screw and washer that I showed you about earlier in the front, that's what these are. These are ALIF. This means assisted lumbar interbody fusion. I think that's what that stands for. But this is a 13 millimeter titanium washer. And then we had a 25 millimeter screw. Here's the catalog number for the screw and the washer. And then that is the lumbar. This is the lumbar cage. And all of that stayed in. So we're not going to be making an adverse event report on that. But as you can see, this cage had something the others didn't, which means it had a lot and serial number, which is right here, A155. The manufacturer is listed here. For web, there was no expiration date listed. So again, we don't need to include that in our adverse event report to the FDA. So hooray for that. The ones that I am reporting are going to be from this line item here down. So 1, 2, 3, 4, 5. You can see I had 2 of this type of screw, 2 of this type of screw, 4 of these set screws, and 2 pieces, 2 and then 2 rods. So 10 pieces of hardware here. And you can see that all of these were made by Medtronic, and they were posterior in my L5S1. And that's what this looked like. So because they have a catalog number, I was able to contact Medtronic to get a list of what the material composition was in this hardware. Here's what that looks like for the Medtronic pieces. Here's the materials that make up those implants. So the manufacturer, kudos to Medtronic, helped me a little bit with this. These were the part numbers for the set screw, the percutaneous rod, the other rod that I had, and then the other pieces that were in that hardware. And the material name is listed over in this column. We have something we see pretty often with commercially pure titanium implants, this TI6AL4V, which we've talked about. This TI is titanium, 6 aluminum, 4 vanadium, titanium alloy. We're going to go elsewhere to get a list of what this particular TI6AL4V composition looks like for Medtronic. It can be different with the different manufacturers. So this set screw was made of this alloy. This percutaneous rod was made of this alloy, which is called a wrought cobalt chrome alloy. And we will get a chemical composition for that here in a minute. But these 2 percutaneous rods were made of this alloy, and cobalt chrome can be very problematic for a lot of people. I wasn't allergic to it. That didn't mean it wasn't affecting me. And I did show in my orthopedic analysis lymphocyte transformation test that I did have detectable levels of cobalt circulating in my blood. That is a known neurotoxin, and it's been shown to be cardiotoxic, neurotoxic. So not a good thing that you want floating around in your blood. I needed the surgery. I'm glad I had the surgery. I would repeat the surgery again. Surgery's benefit versus risk. Did the risk versus benefit help me? The surgery helped me tremendously. It restored my ability to walk and function without pain and nerve pain. But I wish I would have known ahead of time that patients could react systemically to hardware, or that there was nickel in my hardware. We just have to have a whole dialogue around this conversation that we're not having. So I could have saved 10 years of disability if I had known and had some of these discussions ahead of time. So anyway, going down the list, again, we have another part number with another TI6AL4V. But this one, it also has the wrought cobalt chrome alloy and also unalloyed titanium. So each one of these things here, this one, and this one are all going to have a different chemical composition. So we're going to look at those individually. Let's go do that. This is the correspondence I received back from Medtronic. Now, some device manufacturers will not respond to the patient. They will only respond to the surgeon or the rep. If you're lucky enough, like I was, to get them to respond, this is what it looks like. So they said, "Dear Ms. Guest, thank you for reaching out to Medtronic. Based on the items listed on the documents I provided to them, here is the composition." So again, this is right off the implant log. The set screw is this Ti6Al4V alloy. The percutaneous rods are this wrought cobalt chrome alloy. And then these others are a different Ti6Al4V titanium alloy. Again, we see these components are this titanium 6Al4V titanium alloy, which we saw up here. I believe it's the same alloy, but this can vary depending on who the manufacturer is as to what is actually in this titanium alloy. So again, always do your homework here. But also in this is not only the titanium alloy, but the wrought cobalt chrome alloy and unalloyed titanium, which is commercially pure titanium, according to Medtronic. So let's find out what's in those, okay? So our titanium alloy, this Ti6Al4V titanium alloy here for Medtronic, is composed of aluminum 5.5 to 6.5%, vanadium 3.5 to 4.5%, iron, and here's the abbreviations for these elements, back to high school chemistry, oxygen, carbon, nitrogen, hydrogen, and titanium. So again, there's no nickel in this titanium alloy here constitutionally. That does not mean there's not trace nickel. And if you're allergic to trace nickel, very, very small microscopic percentages cause people to react. If you've heard my story, you know a lot about that. And if you have titanium implants, it doesn't mean you're not reacting if you're nickel sensitive. So that was my case. My big thing was nickel. But here's the interesting thing. You get down into this one with the wrought cobalt chrome alloy. Well, we're going to go down this list of constitutional elements. Chromium, molybdenum. I'm allergic to molybdenum, right? In the first orthopedic analysis test. Manganese, nickel. There you go. Nickel is in this implant. 1% max. That 1% lit me on fire. Okay, we've also got silicone, iron, nitrogen, carbon, and cobalt. That's in the wrought cobalt chrome alloy percentage. It also has unalloyed titanium, which is known as commercially pure titanium. What's in commercially pure titanium? Well, let's go down here and look. Iron, oxygen, carbon, nitrogen, hydrogen, and titanium. So we've got these small percentages of these other elements, and then the balance is titanium. Again, trace nickel is not required to be listed by the FDA. Trace nickel is always in commercially pure titanium. Trace nickel, even if it's 1/10,000th of 1%, which is what I have in my pelvic implants, it is enough to cause you to react if you're systemically allergic. And we see it all the time. And the big myth that doctors don't understand is that you can react to commercially pure titanium by way of the trace nickel or other alloys in the commercially pure titanium. Maybe it's the vanadium. Maybe it's the aluminum. Many patients who are allergic to metal are cross-reactive to different kinds of metals. So that's how you get the implant log and determine what's in the implant to take it from here to the next step, which is filing the adverse event report for these particular item numbers on the implants. I'm going to walk you through one more thing that I talked to you about in my last episode with orthopedic analysis, which was episode 27. This was talked about at the end of the episode, but again, I want to recap it here so you can follow my whole journey that I talked about with Dr. Caicedo. I had to have a surgery that implanted 4 titanium microplates in my pelvis for Tarlov cyst disease. I had 2 cysts on the S2 nerve root in my pelvis, and I knew ahead of time because I discussed with my surgeon that they were going to put these 4 titanium microplates in. And we went to the manufacturer through the doctor and found out what the chemical composition was on my implant. Let me show you what this looked like before surgery. The microplates were made by Lawrence. It was the plates and screws. And here is the material data sheet for those implants. And right here it says implant material plates, commercially pure titanium, ASTM F67, screws, titanium 6Al4V alloy, ASTM F136. So we're not going to know what these implants are constitutionally made of until we go look up the chemical composition for this ASTM F67 and ASTM F136. I'll show you what that looks like. Okay, here's the data sheet for the TI6AL4V ELI ASTM F136. Titanium is the balance. Aside from these other elements that are listed, if we go from the bottom, carbon max 0.08, oxygen max 0.13, iron max 0.25, vanadium 3.5 to 4.5%. If you're allergic to vanadium, this is a problem. Aluminum 5.5%, 6.5%. Again, if you're allergic to aluminum, this is a problem. But and the titanium is going to be the balance of what's left. Now, this is only for TI6AL4VELI ASTM F136. So that's what that one looks like. Let's go check out the other one. Okay, here's what the ASTM F67 spec sheet looks like. You're going to get a big sheet like this. That doesn't tell us what the chemical composition is there, but if we scroll down, wait for it. Here you go, F67 chemical requirements. So in our ASTM F67 implant, we're going to have nitrogen, maximum. These are the different grades, but you can see very small percentages here. Carbon, hydrogen, iron, oxygen, and titanium is the balance. Again, no constitutional nickel. Why is this important? So they put those implants in February. Walk you through a journey here. I'm going to show you what happened next. Actually, before I do that, I'm going to just tell you what happened. So going back to the first lumbar fusion surgery, before we found out that I was allergic to nickel, I had my plasma histamine drawn and it was 3.53. Anything over 1 is high. Let me show you what that looks like. Here we have this lab draw. Here's my plasma histamine. You can see the range. Anything over 1 is high. I was 3.53 and this is on July 3rd of 2020. This is about a month before I had my lumbar fusion hardware removed. Let me show you what the after plasma histamine labs looked like. As you've heard me say before in my story, this was with no change to outdoor pollen, diet, medication, anything. This is a few weeks after my lumbar fusion hardware was removed. Look at my plasma histamine here. 0.016. Anything over 1 again is high. I'm now at the lowest end of normal with no changes to diet, medication, outdoor pollen, nothing. So it was simply the removal of the 10 pieces of lumbar fusion hardware that changed. And if you remember what that lumbar fusion hardware had in it, constitutional commercially pure titanium with trace nickel, and then a cobalt chrome alloy with 1% nickel. It was enough to light me on fire. And when I woke up, 60% less pain in my legs in the OR. I could immediately eat high histamine foods again. I could immediately go outside on high pollen days again. The metallic taste was gone from my mouth and I could wear jewelry again. So again, that was just one instance of very small amount of nickel making a massive difference in my chronic pain picture. So now let's go forward again to the pelvic surgery. My first orthopedic analysis results that were in July of 2020 come back showing slightly reactive to molybdenum, slightly reactive to iron. This is before they changed the reference range, which is now anything over 4, but I still would have been positive because you can see my high concentration of nickel was very reactive. That was my first one. That's what led us to having the lumbar fusion hardware removed. I had 4 small titanium microplates implanted in my pelvis in February, no constitutional nickel. I get this test pulled in April. Look, my nickel reactivity has gone from 6 to 12. It is double. Now, Marco Caicedo said it's not necessarily related because there's a lot about the immune system we don't know. It could have just been the metal debris from having my hardware removed. But I personally feel like there's a correlation here. And it'll be interesting to see now that I've had those plates removed, if I have another repeat orthopedic analysis test, what happens here to this measurement of nickel. But I think it's certainly interesting nonetheless. And if you'll recall, none of these implants in my pelvis, little bitty microplates, had no constitutional nickel. But yet I'm having a massive reaction to nickel here on this orthopedic analysis blood test just a couple months after surgery. And the interesting thing about the delayed hypersensitivity reaction, at least for me, is at the time this blood test was pulled, I thought I was doing great with the implants. I thought I'd removed enough metal that I wasn't having problems. I wasn't having any trouble in April when the lab test was pulled. In June, my hair was falling out. I was breaking out in hives. I was having massive chronic pain just from these 4 little microplates with no constitutional nickel, right? I'm definitely reactive. And then another repeat experiment. My doctor surgeon went back in to remove the plates, which he had already agreed to do. and literally woke up out of surgery, able to do math in my head again. The week I came out of surgery from having those plates removed, my hair stopped falling out and the chronic pain is gone. And I'm taking less antihistamines. So y'all, trace nickel is a big deal. If you're allergic to nickel, you're likely going to have systemic issues if you are one of the patients that is systemically reactive to nickel. Doesn't matter if it's commercially pure titanium. So I'm not saying never have a surgery that implants titanium, but you're going to have to choose your quality of life. And do you take antihistamines? Do you have that hardware removed later? I mean, there's so many questions to ask around this allergy. And going back to, we need more metal-free alternatives. That's a whole other thing. I'm going to go to FDA.gov. That's where you want to start. This is the U.S. Food and Drug Administration website, and you're going to scroll all the way down to medical devices here under products we regulate. You're going to click on medical devices. When you get to the medical device reporting page, how to report medical device problems, there's a lot of really good information. There's two ways that you can report this. You can report this electronically, or you can report this on paper. I'm going to choose to report this on paper, and I'm going to show you how to do it both ways. It gives you a little bit of background about patients and consumers and the whole reporting process. Surgery centers can report, doctors and patients can report, facilities can report, and the overview is really here on this page, but I'm going to let you read that data for yourself. The important thing is I want to show you how to file your own event report, and that's a pretty simple process, believe it or not. Earlier, I've showed you how to get your device implant log from your surgeon or hospital, and that will list your specific implants, the manufacturer, the serial number, the control number, any relevant information that you're going to need for this report. So in this segment, we're just going to talk about how to actually file the report. So you're going to want to come to this page here, your MedWatch online voluntary reporting form. You're going to scroll down here where it says consumer patient. Now, if you're a health professional, obviously you're going to go to the health professional. They're both form 3500. The physician form is the regular 3500. The patient consumer form is 3500B. So you're going to click here where it says consumer patient. It's going to take you to this page here, and you're going to start to fill this out. And I've already done this, so I'm just going to mock fill this out. I won't put any of my identifying information in here, but you'll get the general gist and idea. What kind of problem was it? I was hurt and I had a bad side effect. I'm going to click that. And then I'm going to scroll down here. Did any of the following happen? Now, in my case, I'm just going to go off my first implant. Yes, I've been hospitalized from pain and all kinds of other symptoms, cardiac symptoms, ANS dysfunction, just crazy stuff. I also required help to prevent permanent harm, so I'm going to check that box. And I acquired a disability or health problem, so I'm going to check that box. If any of the others apply to you, then feel free to go ahead and check that box here as well. I'm going to go ahead and click life-threatening because I had some SVTs, which are supraventricular tachycardias, where my heart rate skyrocketed to over 200 beats per minute. I collapsed, literally thought I was dying. I did not die, but I probably could have, honestly. So I'm going to click those and date the problem occurred. I'm just going to put January 101, 2001. Okay, for right now, we are going to type what happened. This is the printed form that I did. And I'm going to submit by paper, but I have to submit a medical device adverse event report for each piece of hardware. That means every screw, every plate, every washer, every piece of hardware that they've taken out of my body, I'm going to file an adverse event reporting for. So basically, I have here 15 sets of paperwork for this form. And if I don't file online, because I kind of prefer to do everything on paper. Online, they can say they lose it. Paper, you can fax it in and you've got tangible proof that you sent it in. That's just my personal preference, but I'm going to fill out an adverse event report for every piece of hardware, every serial number, every control number, and every piece that came out of my body, which for me, it's a lot. I've had 8 surgeries to remove hardware, and I want to make sure they all get reported because this is how change happens. But for me, there was a lot of data that was the same, and we're going to get to it as we go down the form here. But basically, I just picked up a blank piece of paper and I typed the answers to those questions in segments, in paragraphs that I could basically cut and paste. What it looked like is printing out the page and cutting it up and taping it to the segment on the form where it goes, and then copying the form. So I didn't have to redundantly fill out the same bit of information over and over again. That's what worked for me. So you can see if I take like page 2 here, okay, there's this whole big narrative that I have right here. And I don't want to type that over and over again 15 times. So I basically copied my piece of paper 15 times. I made cutouts and I taped it to the page and put it back on my copier and made 15 copies. So I can go and really speed up the process. And I did that on every single page where there's redundant information that would just have to be listed over and over. Like one, it asks for a list of your prescription medications. One, it asks for a list of your medical conditions. I'm not going to write all that or type all that ad nauseum, and it's not a typable form on the printable version. So that's what I did. That's just my preference. But the same information is going to be asked here. I'll probably go to my form and copy that in. So here's how it happened, right? We're just going to type in how it happened, or you can copy and cut and paste your pre-written version into this area here. Do make sure that if you have different implants, that you don't have something that's hardware specific to a certain surgery in when you're just copying and pasting. You want to make it relevant to the piece of hardware that you're reporting, because the manufacturers are also going to get this because you're going to copy them. So anyway, you go in here and you write that relevant test and laboratory date. For me in this, I have had 2 orthopedic analysis LTT tests. I've had a ELISA test. For my lumbar fusion surgery, for example, I also had a pre and post implant removal histamine lab. This was serum histamine. In my case, it was really revealing because prior to having the implant removed, my blood histamine was like a 3.53, which is off the charts. Anything over 1 is reactive. And so I had that drawn. It was 3.53 prior to surgery, 8 weeks after surgery with no change in diet, medication, or outdoor pollen. I had that redrawn and it was the lowest end of normal. To me, that shows a complete correlation, my plasma histamine and the reactivity in my body. Also, if you didn't hear my story, when I had that first set of 10 pieces of lumbar hardware fusion removed, even though I have a ton of metal still in the rest of my body, 60% of the pain in my legs went away in the OR when I woke up from surgery. And I was immediately able to experience histamine relief in the sense that I was able to eat high histamine foods again. I was able to go outside on high pollen days again. For those of you who have heard my story, you get this, but it was real and it was tangible. And from the minute I woke up from surgery, I could wear jewelry again. And the metallic taste that was in my mouth was gone. So these are real definitive, like you had to be there moments that some surgeons really still kind of poo-poo the fact that that happened to me. And I'm like, I was there. I know. Okay, let's keep going. So my relevant laboratory tests. I listed both my orthopedic analysis tests here. I listed my ELISA diagnostics test here. I listed here my pre-implant and post-implant histamine measurements. And these are just really good benchmarks, I feel like, for the FDA to start to put 2 and 2 together. We can hope that they will. So you're going to enter each of those tests here. If you have more than one, you add another test right here. And then you scroll down. Please select the cause of the problem that applies below. Yours might be similar to mine. For me, it was a problem with a medical device, which is any health-related test, tool, or piece of equipment. Any kits don't apply here. Implants, such as breast implants, pacemakers, or catheters. If you have an IUD, it would go here. Cardiovascular stents, cardiac stents, any kind of medical device is going to go here in this. And then it'll ask if you still have the product in case we need to evaluate it. I actually have my tendon anchors. So some of these I'm going to click yes, some I click no. When I first had my hardware removed, I didn't know that getting your hardware back was a really good idea. I didn't do that for all my pieces of hardware, but I did it ever since I knew better. Some I have, some I don't, but you're just going to mark one here. Do you have a picture of the product? For me with my tendon anchor, yes, I have a picture. So I'm going to mark that here and I'm going to upload the file here if I have it. I'm not going to show you how to do that because you should probably know how to do that from your computer, but basically it'll take you to a place on your computer where you select the file and then you click open or attach or whatever you click on your particular software and you can drag and drop. So that's awesome. And then you're going to click next. I have not uploaded a picture. I'm going to go in here into my imaging. You're going to love this picture. This is my tendon anchor. It was corroded and pitted. It had rust on it. It was really nasty. So that should tell them something about pure inert titanium, right? Okay. So next we're going to go and hang on. It's a good thing we did this. Begin upload. You can see right here where it says the file size and 0% uploaded. So we're going to click begin upload. There we go. You can see it uploading right here. And there we go. We've got 100% upload. And then we're going to click next to go to the next page. And so device information. I'm going to put name of medical device, tendon anchor, and the name of the company that makes the device. Right here, I'm going to say Biomet. And I may not be correct here. I've got a lot of implants, so I'm just picking a hypothetical here. Okay, model number, catalog number. Model number is the exact model number found on the device label or accompanying packaging. I don't have that, and you won't have that, because if the implant is in your body, that label is long gone, y'all. So catalog number. This is what I do have on my implant log, and you've seen that before. So I'm going to enter that right here. If there is a lot number or a serial number, I'm going to also enter those here. The unique device identifier number is going to be from certain hardware coming forward. A certain year, there was a big, huge label with a lot of numbers. Again, we don't have the packaging for our implants, so we're not likely going to have this unique device identifier label. You can just skip that. Your adverse event reporting info will still be filed. And by the way, so if you're filling out the paper form, or if you need to know, the first page of this is a form that shows you how to do everything. Basically, it tells you at the bottom of this form, let me see if I can show you, right here at the bottom of the form, it gives you a number that you can call if you have questions to get to a super helpful person. There's a phone tree that you've got to go through there. Press 1 for this, press 2 for that. Listen to the appropriate prompts and you'll get to the right person. I had to call in because I wasn't sure about the unique device identifier. If a physician or a facility was filing this report, or a manufacturer, they would have this and they could input that here. But as a consumer and the patient, you're likely not going to have this. So it's okay if you don't, just skip that. Expiration date. This is if you have an expiration date of the product. Usually for my implants, I have not had that. So again, this is something I skip. Was someone operating the medical device when the problem occurred? Nope. Nobody was operating it when they put it in my body. Implants don't operate themselves. Unless you have a spinal cord stimulator or something like that, then there might be something. But in my experience, I don't have that. It'll ask you about the person who's operating it if you have that. And then for the implanted medical devices only, such as pacemakers, breast implants, etc., you're going to want the date the implant was put in and then the date the implant was taken out. You should have it with your operative report or your implant log. But if you don't have that, just get as close as you can, maybe the month and year. I think that's really important. So then we're going to click next. Then it's going to ask some demographic information. You're going to initial up here. It's going to have you enter your sex and your gender, your age, your date of birth, your weight, and whether that's pounds or kilograms, your ethnicity and your race. And then a list of known medical conditions. I have systemic nickel allergy syndrome, or I have lipedema. List everything else that you have here. Then you list your allergies, and you can list up to 2,000 characters. Again, you can copy and paste your medical conditions, your allergies, anything that you've written on that other piece of paper that you have on your computer desktop. You can just copy and paste that in here, especially if you've got a lot of these to do. List any other important information, whether you smoke, you're pregnant, you abuse alcohol. I don't do any of those things. I'm not pregnant, well past that. So skip that. Then you list all current prescription meds and medical devices being used. For me, I have listed all my implants that I still have in my body, and I've listed the implants that have been removed from my body. And then it wants you to come down here and list all over the counter medications, any vitamins, minerals, supplements, and herbal remedies that you're using. Then you click next. Once you've inputted all that, reporter, your first and last name, your preferred address, your contact information. Did you report the problem to the company that makes the product or the manufacturer or the compounder? And there's a place here. If you don't want your identity disclosed to the manufacturer, you can put an X in the box here. It's going to require my first and last name. So let's put that in here. Sherry Guess. Some of these things, it just won't let you move on without them. Once you click next, it gives you a summary here of everything that you typed in. And you click this reCAPTCHA, I'm not a robot, and then you can submit. So again, it doesn't need to be a really, really daunting thing to submit this to the FDA. And then you can submit by paper copy. You have options to email, mail, or fax. That's great. If you mail it in, my advice is to do certified return receipt requested, especially if there's legal litigation pending. You feel like there's going to be a lawsuit at some point in the future. You want to be able to track everything that you do with the FDA, your providers, the manufacturer, medical professionals, and so on. So that's basically how you do it. And again, do it over and over for every single device, washer, screw, plate. The more voices we have blowing the FDA up about metal allergies, the better. I'm going to actually read you what I wrote in what the problem was. And this is the one I copied over and over again. You might want to do something similar or have a similar format, but this was my story and it's going to be true for a lot of you all. It says, tell us what happened or how it happened or why it happened. I developed severe type 1 and type 4 delayed hypersensitivity reactions to the medical hardware listed. This allergy resulted in a litany of symptoms from SVT and cardiac symptoms, symptoms of postural orthostatic tachycardia syndrome or POTS, hives, chronic systemic pain and inflammation, rashes, brain fog, mood swings, chest pain, weight gain, insomnia, chronic fatigue, overactive bladder, night sweats, hair loss, itching, joint pain, and slow wound healing, swelling, depression and anxiety, blurred vision, seizures, numbness and tingling, light and sound sensitivity, dry skin, hair, nails, burning sensations, electric shock sensations, and a hyperactive immune system, which resulted in the activation of multiple severe chronic infections such as Lyme disease, EBV or Epstein-Barr virus, brucellosis, babesiosis, Bartonella, HHV6, Mycoplasma pneumonia, and chlamydia pneumonia. So all diseases of a hyper-responding immune system. It was trying really hard to fight all the inflammation from the metal hardware, and it caused my immune system to be compromised. Continuing with what I wrote, most all of these symptoms and infections have greatly reduced or resolved completely after this hardware was removed. I have now had 8 surgeries to remove hardware and have gone from bedridden for years to fully healed. Some of these symptoms resolved immediately in the OR when I woke up from the explant surgery, and many continued to improve for 4 to 6 months after explantation. I've experienced this with each implant and explant surgery. I was tested via a lymphocyte transformation or LTT test, both through orthopedic analysis and ELISA diagnostics. Both tests showed me systemically reactive to nickel, molybdenum, and iron. They saved my life because all the other test results were normal. I had suicidal pain. Every cell in my entire body was on fire. The absence of pre-screening and diagnostic criteria for systemic metal allergies cost me 10 valuable years of my life. Equally problematic is that physicians and surgeons are unaware that trace nickel, not required to be listed by the FDA, is present in all commercially pure titanium implants and is enough to make allergic patients react severely and systemically. Not only do physicians and surgeons not realize this fact, but they fail to be able to identify systemic reactions due to metal allergies, and many aren't even aware this can be a problem as they are taught local reactions to hardware only. 20% of the U.S. population is allergic to nickel, and of that percentage, 3 to 5% in the published literature are systemically allergic. That is over 2 million people in the U.S. alone. This allergy needs to be as big as gluten. Doctors and surgeons need to be trained in it. We need more non-metallic device options on the market yesterday. Screening for metal hypersensitivity needs to be routine with every surgeon and facility. Metal allergy and compatibility testing should be routine prior to any implantation procedure. The pain and suffering are unimaginable, and test results are often normal with this allergy. We need to do better. This is a humanitarian crisis. Thank you. That's what will go into the FDA on every adverse event report that I send them. I hope this has been helpful. Just don't be a procrastinator like me and get those reports in. Let's start flooding the FDA so we can get real change in this industry. And so they will realize the extreme amount of death, disability, psychiatric and physical issues, and really just the burden that this is putting on the medical and insurance companies as a whole. The cost of healthcare is through the roof, and this isn't helping. I have probably had at least $1 million or more in medical care between my 42 surgeries and 8 surgeries to remove hardware. And so much of this could have been alleviated if doctors knew what to look for and how to pre-screen for hypersensitivity. And if we had more non-metallic options for implants, right? We could have ceramic, carbon fiber coated, 3D printed. It's not that you can't have a foreign body reaction to these things as well and have a similar response, but we don't even have the option right now for a different implant. So this is really, really going to be incredibly important. Really, I think the big solution is come on, Jesus. I mean, I'm ready to go because it is really scary not to have implant options for cardiac and vascular stents or things where you absolutely have to have an implant and you have this kind of allergy. I've experienced so much pain. I just can't go back there. The PTSD and the medical trauma is a big deal. I would almost say, just let me die. I don't want my life to end, so don't get me wrong. I love my life. But if it was a choice between living or going back to that kind of pain that I was in and staying in bed 24/7, not being able to walk 5 feet, man, let me go to the other side. I mean, I know that life is eternal and I know where I go when I get there. And I'm literally this close to a DNR if that means I would have to have another metal implant. Of course, you always have to weigh benefit. This is just me. I have a body that is full of metal that I can't get out, so it's a little riskier for me. My bucket is completely full. Your bucket may not be. If you're just getting a gallbladder removal, don't let that toxic gallbladder take you out. See if you can get the surgeon to sew or not use clips or use a different non-metallic clip and make sure that they can take out what they put in when you heal from the surgery that saved your life. Look at going and getting those clips removed when you're healed. I've had some miraculous stories on the podcast of patients that have had their gallbladder clips removed and literally come back from the brink of death just from that. It's a real thing. And so I advocate wholeheartedly for finding surgeons who are friendly to taking out what they put in or putting in less or having more minimally invasive options and surgical techniques available. This is all so important. And I really do think that for many people, their life depends on it. If people only knew how much pain they could get rid of or offload just by taking out some of their surgical hardware. I've posted on this before on social media. Obviously, it can't all come out. There is some that saves your life and some that unfortunately people will have to live with forever. And they'll have to deal with those side effects. But maybe tell them that this is a possibility beforehand and know how to recognize the reactions and give them some tools to cope with the side effects, like the low nickel diet. It is a game changer for pain and symptoms. I've lived with the side effects of my hardware for a long time, so it can be done, but there's a lot of side effects I might have chosen to live without had I known there was an option. And I could have gotten on the road to recovery faster had my doctors been aware of and known what symptoms to look for. So use common sense. All I'm saying is if you have hardware that can come out, foot and ankle hardware or a wrist plate or an ankle plate, this stuff all corrodes in the body. And we don't know the results of that and probably won't until we're on the other side. But even if you're not allergic to it, corrosion happens. So if it is no longer serving a purpose and you have healed, it's my opinion to get it out of there. Obviously, again, I am not talking about the stuff that you can't remove. So give me some credit. I think people reading online infer too much. We're all walking around with way more hardware than we need, and we don't need it anymore. The US is one of not very many to tell you to leave it in. A lot of countries will remove hardware and they include that in the global bill for the surgery. Get it put in and then you come back later and have it removed when you've healed and you no longer need it. So it's really common sense. Your immune system knows the difference between something that is supposed to be there and something that is not. If it knows that it's not supposed to be there, it's going to build an inflammatory response around it. It's going to try and get rid of it, break it down. You're going to have inflammation. I don't need to go to medical school to have common sense in my brain. And now, a word from our sponsor. Attention metalheads, are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. Melisa, a valuable diagnostic tool in medicine. Okay, everybody, we have the famous Dr. Scott Schroeder joining us today to answer a few questions about hardware adverse event reporting from a doctor and surgeon's perspective. Welcome back to the podcast, Dr. Scott.
Yes, thank you for having me.
As always, one of my favorite guests.
Yeah,
Crowd favorite.
Thanks.
Okay, we're doing this little episode on adverse event reporting, and I wanted the doctor and surgeon perspective because we're out here floundering around and we don't get that very often. So I'm just going to dive right in to some of these questions.
Do it.
What type of surgeries are candidates for hardware removal and which ones might not be?
I can't speak for everything, but in general, it's very difficult from a surgeon standpoint in many cases, as you have run into, I'm sure. Total joints are more difficult because they're already in there, but there's many times a surgeon tells the patient that, hey, this will only last for 10 to 15 years, and then you have to have something else done. So there's already an anticipation that potentially, and I'm not an orthopedic surgeon that put those in. I specialize in the foot and ankle and that type of thing. I haven't done ankle replacements. I do definitely have colleagues that do and friends that do hips and knees and shoulders and what have you also. It's a difficult question, and it's probably a case-by-case thing. As some of the back hardware that we've worked with people that, things are easier to get out than other things. Multiple clip patients I've worked with, and it's difficult depending on where things are, depending on how much scar tissue, that type of thing. But it has been possible in many cases. It just depends on the surgeon's comfort level in dealing with things. And it's not all surgeons are comfortable in dealing with hardware removal. And so it's finding a surgeon that is comfortable. And if you don't succeed at first in finding a surgeon that's comfortable, then it's checking and looking around and seeking another opinion, because it's not the first surgeon that the people that I've worked with over the years have found to remove things. It's usually down the road, and it may be 2, 3, 4, 5, whatever down the road.
Whatever is very common. Let me ask you, are cardiac and vascular stents able to be removed?
I don't know specifically. I haven't talked to some of my cardiac surgeon friends about that.
If you find out, get back to me.
If they go in and then have to do an open heart and take a piece out and do a bypass, then they could take that section out, I would imagine. Again, I don't specialize in that area, but it is a concern.
From your experience, is hardware removal as drastic as the original surgery?
From my experience, no. Hardware removal has been, at least in my foot and ankle realm, typically when I remove hardware, it's after the bone is healed.
Cosmetic.
I wouldn't call it cosmetic, because typically whether it's prominence of the hardware or then we're having a multitude of symptoms, some of the systemic symptoms, we're not aware it's even related to the hardware. Whether it's headaches, chronic fatigue, fibromyalgia type symptoms, that type of thing, you have no idea it's related to the hardware in the foot or ankle. But then it's an incision over the hardware and then going in and removing the hardware, scar tissue in the way and that type of thing. We deal with that all the time, depending on the extensive nature, which usually is not too extensive as far as hardware removal goes. And we still have an incision that has to heal. We haven't had to repair any tissues other than just closure on the way out. So we follow the same guidelines for making sure we don't have infection and keep the swelling down and that type of thing. And we just have the incision that has to heal, not the bone.
I've got so many followers with doctors who do not want to remove their hardware. If this happens, what do you suggest for the patient?
Again, it's unfortunately having to go to a different doctor. One of the big things I see in people that I work with that it certainly appears like they need their hardware removed. They've had testing, or they can put it in the time and place that, okay, I got my surgery and hardware placed at this certain time. And then after this period of time, whether it's weeks to months to sometimes even years afterwards, that these symptoms had developed. And then I've gotten tested and found out that I'm allergic to one of the metals that's in the hardware. Testing is a big thing, I believe, as far as for surgeons to understand. It's better to try to keep it simpler than more complex that is overwhelming to the doctors. The biggest things that hopefully is part of it is that if there's chronic swelling or discomfort, that's what I think people should concentrate more on than a systemic symptom someplace else.
Which is interesting. I didn't have any of that. I had some tenderness if you palpated around the area, but I didn't have any redness or swelling or anything that you could see. Even when they took the hardware out, they didn't see any inflammation there, but yet there was all the systemic thing.
And unfortunately, that's a number of these cases. But what I think you have to gear in on is the local symptoms. If you believe that, yes, I have systemic symptoms that are related, you can go into some of that. But if a doctor has a patient come in and it's just this and this that in their mind they haven't seen before, then it can be very difficult trying to convince them, so to speak, that this removal and the potential risks and complications of hardware removal, and each case is different. But these symptoms or the surgery risks and complications of the surgery would warrant going in and doing that.
Why do you think so many are reluctant to take it out?
The surgeons that I see and I talk to and other people that are their patients, of the surgeons that are more likely to take it out have had experience with it before. The ones that are really more likely to are family members that have had mental issues. And so, they're in speaking to is a neurosurgeon, spine surgeon over in the New York area. And then the person that I was working with and discussing things with, that surgeon's family member had a problem. And so they're very more willing to listen and then, okay, let's see what we can get figured out.
So you can correct me if I'm wrong here, but I'm hearing you say they're not trained in it necessarily. It's not necessarily easy. And sometimes they go for easy and familiar and convenient.
I was never trained much in it at all. Most, I think, surgeons, I don't think we are adequately trained at all as far as the potential risks and complications associated, whether it's metal allergies or metal reactions in the body that we're seeing. So, I think it's a training issue. Definitely, when I presented to the FDA, that's one of the things that I said, we need better education of this, but it's still new, so to speak, even though it's not, at least in our educational process. And it's starting to come out more and more.
The famous Dr. Julio Novoa said a good surgeon can put hardware in and an excellent surgeon can take it out.
Yeah. One of the orthopedic surgeons in my home hospital, he said, boy, hardware removal can make us all look bad because it can be extremely difficult.
So I'm an excellent surgeon. Do you think removing surgical clips and staples is generally safe? Obviously, it depends on the location and things like that, but more safe than many doctors believe it is?
Again, I'm not that type of a surgeon. I can't comment. I've heard of many patients that have had them removed and done well with all of that. Obviously, there's scar tissue in the area. Typically, they've clipped vessels, so the surgeon's concerned about bleeding or tearing other tissues, structures, nerves. Any surgery has potential risks and complications. In my later years, anytime I would go to put something in, I want to make sure I can get it out. Device companies, reps would come to me and say, here's this great thing. And I go, how do you get it out? You can't. Yeah. Okay, bye. And they knew after a while not to talk to me,
When we're trying to get chemical compositions for a certain device or implant, is it better to go through the surgeon and have the surgeon go through the rep? Why do the device manufacturers not want to talk to the patient?
In my mind, it should be all out there. As a surgeon, if I'm putting something in a patient, I want to know what I'm putting in the patient, and the patient should know what is being put in the patient. What I hear is it's proprietary information as far as what the company puts in their implant. But that's the wrong answer. If the rep or the company family member had something, would they want to know what's being put in their family member's body? That should all be out there, and that was actually brought to the attention of the FDA, at least back in 2019 when we talked to them. They said, okay, let's include that with the device. But I don't know if I've truly seen that come out yet. Hopefully, the surgeon's team, maybe not the surgeon itself, but the team should be able to find that information I think it can be very difficult for the patient to find that. It should be a pretty simple, straightforward question.
Is it an unusual request for a surgical team to get that information? Do patients ask?
I'm hoping that it's going to be a more common request, and it should be.
Right.
It's your right as a patient to know what's being put in your body. And truly, it's the responsibility of the surgeon to know what they're putting in the body, even though I didn't always know what I was putting in my patient's body because it wasn't readily accessible, but it should be there.
When I'm filling out an adverse event report, it's asking for the UDI, which is the unique device identifier. It's a long thing that is on the label of perhaps the implant. Is that something that they would get for the surgeon? Is that something a patient wouldn't necessarily have once the implant is in? Are you familiar with that?
It may be something I haven't been familiar with per se, but all surgeons, in the way past, many things that we take it out of a package, there'll be a sticker or what have you, and they'll put it onto a sheet in the operating room. The nurses will. Every screw, every plate, they write down.
Yes.
And then you have to ask for that.
We have the operative report that's available. Right. We have an implant log in most cases that's available. Then there's also this list of tools and supplies that are used in the surgery. I call it a pick list, but I don't know if that's correct.
It is. We have a pick list for every single case. It's just the instruments that we use in the case. But it's really the implant log. That's what's placed in your body.
It was interesting that I didn't find my surgical clips from my cholecystectomy until I found the pick list. It wasn't on the implant log.
That's interesting because I spoke to a cardiac surgeon that I had worked with that I said, we were talking about metals in the body. We talked about vascular clips. And he goes, oh, we don't report those. And I go, why not? And he goes, I don't know. We just haven't reported. I go, they're a piece of metal being placed into the body.
Sure.
And he goes, yeah, you're right. And so, yes, exactly. And so should they be doing it? Absolutely. Sometimes they do? I believe so, especially when it's more of a primary thing, the cholecystectomy. But when they're just doing another surgery and just, okay, I need some clips, whatever, they just grab the clips and they get the little stapler and they staple, but they don't log that.
Mm-hmm.
So, yes, then you would have to go back to the pick list to know that's what they picked for the case. Yes.
All right. And that's a good term. So, okay. Pick list. So how important do you feel it is for patients to file adverse event reports? And a follow-up question to that. Do you feel, is it important and necessary to file for like a different report for every screw, every washer, every piece of hardware?
I don't know how that all works as far as how they do it, because how do you know it's because of that screw or that washer or whatever? I think it would be, at least initially, it should be the case that you had whatever surgery done. Okay. Dr. Schroeder put these screws in my foot.
And this washer and this plate, and it was a global adverse event report for the one case of the surgery.
I think that's where it needs to start. And we should be doing it on every case that we have an adverse response to or reaction to, because that's the only way they find out. The device, number one, the FDA, and then the device company and what have you, to find out what the problems are. So we should be doing it. Now, the question is, do we know, can we relate a headache or a neck pain or back pain that came on after a foot surgery? Can we relate that? The real way to relate it is if you take the hardware out.
I was going to say, you remove the hardware, the headache goes away. Bingo.
And so that's the main way to do that. Sure. And all of those should be reported, because that's the only way we're going to learn as a society and medical community to do the right thing for our patients.
And I'm learning, too, that the patient should file the report, the doctor should file the report, and then we should give a copy of the report to the manufacturer as well, which is an interesting thing.
That would be best. What's going to be done with all those reports? I don't know, but every single group should have a report. Yes.
Okay. Should patients ask for their hardware back, and what should they do with it if they get it back? And then what's the process before it's given back to the patient?
If they feel they're having a problem with the hardware, then yes, ask for it. We never had a problem at our hospitals as far as giving it back to the patients. I keep on hearing, hey, you paid for it, your insurance, whatever, you paid for it. It's your hardware. You should have the right to get it back. And that's what I hear.
Wall.
What's that?
Frame it and put it on the wall.
Yeah, no, you keep it in case, like now we're doing an explant study where we can take the devices and check and see if we're having issues and what have you. Or to see what, if you don't really know what's in the metal that was placed into you, which many times you're not given that information, the surgeon may not even know, then it can be now all the engineers and corrosion engineers and all this can break that metal down and find out exactly what's in there.
Sure.
As far as the metals. And so then, and if you do indeed have an allergy, then you can say, yeah, I'm allergic to this and this was in this metal now, and these symptoms went away. So then in future in your life, you can go, oh, no, I shouldn't have cobalt. I shouldn't have nickel, or we should avoid that the best we can, or what have you. But yeah.
Okay. Is hardware removal generally a problem for insurance to authorize, and why or why not?
I have not had a problem with it. It depends on the code, the code that's utilized. And basically it's in my cases, you know, is there pain at the site? Yes. Are there potential other symptoms? Yes. Or a swelling. A lot of my cases, you expect after surgery, you're going to have some swelling, right? But what was dramatic is after I removed the hardware, in well over 60% of cases, the swelling went down. Dramatically within days.
Yes.
Okay, that's an inflammatory response, okay, to the hardware. And that's what I anticipate I'm having. And so you use a code, or it's a pain or what have you, code and there are codes out there for inflammatory reaction to metal hardware or what have you. And I haven't had problems with insurances covering that, whether it's Medicare or welfare or what have you.
Do other countries worldwide remove hardware as part of their general standard? Do you know?
From one of the medical device companies reps who spent a lot of time, they sent them over to Europe a lot. And they said in Europe over there, these are in a lot of the areas, it's temporary fracture fixation where somebody breaks a bone. They put the metal in, the bone heals, they take it out. And he said that was more standard over there. I haven't talked to the surgeons over there. That just came from the rep.
Okay. In the case of somebody with a lot of surgical metals, do you have to get it all out, or is it helpful to take part of it out?
Yeah. I have seen on many cases where it has been helpful to take part of it out. And now determining which part, sometimes it's by trial and error. And I've seen and I've heard my colleagues in Europe where they had ongoing pain with a total knee or total hip. And they had, but the surgeon said, hey, everything looks great. Everything looks good. There's no osteolysis or softening of the bone around the implant. It looks to be functioning well, and not a problem with that. But then they remove some of the dental metals, and the pain in the knee or hip goes away.
Yeah, crazy.
So and I've had those cases too, where I had stainless steel in this one patient's foot that I had done surgery 18, 19, 20 years prior. And then after that, they had back surgery for fusion of their low back with titanium. And then had ongoing pain with that, but then had a knee surgery. And after the knee surgery with titanium, had even worsening pain in the back. And then she was having some problems in the foot too. And I removed all the stainless steel in the foot. And her back pain that was over 7 to 8 out of 10 that she had for years, after I removed the stainless steel from the feet, the back pain went away.
It probably makes sense, at least in my little pea brain. It makes sense because it's an inflammatory response. And if you lower the inflammatory thing, then even though there's probably still hardware at the spot in her spine, there's less inflammation over it all. So it just took it down a notch, basically. It would be my hypothesis. Hard to prove, probably, but
right. I think
that's
one hypothesis as far as that goes. Another hypothesis that we're working on that I feel we've been seeing is actually a potential reaction between dissimilar metals in the body. We have the body fluid as an electrolyte. We have different charges of these metals in the body, with titanium being a little more on the positive side, stainless steel being more on the negative side. And if we are getting some type of reaction between the two, with a galvanic type reaction and where electrons are flowing, and we remove one side, then boom, that may be real. And that's a hypothesis we're working on and writing up actually as we speak.
Yay.
So, yeah.
Is the attitude toward hardware and metal removal and metal implants changing, do you think?
I do. I think it's way slower than any of us would like, especially patients. But I am finding more and more people amenable to talking about it, even some of the younger surgeons, and that were, I don't know if it's different philosophies or what, but I do believe some of the younger and even some of the older inquisitive docs like myself that have had some issues with patients are going, okay, I'll listen to you. And so I think it is finding that surgeon that then is willing to listen to a patient with a problem and then trying to keep working with it. But I think, again, we do quelling everything down at the beginning when you're talking to a surgeon and not just going, oh, it's this, I think it's all related to that. You can get to that, but it's a calmer state at the beginning when you speak to a surgeon, because I think many times you scare the surgeon off.
Yeah. Can you elaborate on that anymore? Because I see that over and over again. These patients walk in chronic fight or flight, and the surgeon doesn't, literally in 30 seconds, the surgeon's, nope, not my wheelhouse, not my.
Oh, yeah, I totally see it. I see it from all standpoints. I see it from the surgeon's standpoint too. That you have somebody come in and then they are already, and I get it from the patient's standpoint.
They bring their file that's this big.
I know.
And the surgeon's, nope.
Yes. And that's what I'm saying with all this. I think you got to come in with a little bit and then get a rapport with the doc and then be on as calm as you can and talk, okay, I'm having this ongoing problem with this. And it started, and really get the timeline down. I had this procedure, whatever it might be. But then I started getting these symptoms, maybe not right where that is, but elsewhere. And I'm concerned because I've been reading and what have you, and don't get into a whole lot of the internet stuff as much, because we hear that all the time. And I've had patients come in and say, hey, I read this on the internet. And I go, okay, good, about these symptoms. And then I look at my diagnosis, it's pretty straightforward. And they go, that's not what I read on the internet. Thanks. Okay. See ya. I don't know why you came in to see me, but doctors do see that a lot. And so you got to quell it, I think, a little bit on some of the, stick to your symptoms and the timeline of when things happened, and don't overload them with too many symptoms all at once. You can bring things in, but it is hard because some of the metal reactions that I've seen with my patients over the years, it brings out all kinds of anxiety. And then they spend not sleeping well, anxiety, headaches, pain here or there. They don't understand what's going on, and they're flipping out.
Medical trauma and PTSD is real. Trust me.
Yes, and it is, and it's going to be very hard for people to quell down. But if you want the best fighting chance of having a surgeon listen to you and help you, you're going to have to fight it the best you can to try to keep it on a level where you're not scaring the surgeon.
And I would say I would add to that, if you have a surgeon, and correct me if I'm wrong, if you have a surgeon that's not open-minded at all, don't waste your time. Thank him for his time and leave.
Yeah. And I would agree with that. Don't try to convince the surgeon of what, because they may not know that. And sometimes it's not always appreciated when you try to tell them something they don't know.
Right.
Well, probably most of the time it's not. And so, yes, and if they're not on board, then yes, thank you. I guess we're on different pages here, but thank you for your time. And then go on to somebody else. Yes.
Got it. Okay, last question. Are you aware of any metal-free options and implants for metal allergic patients coming down the pipe that you're excited about?
Yeah, there's one that's a biointegrative screw and staples. It's not advanced to the area that I would like to see yet. And I've told it's called, have you heard of osteofiber?
I have. We're going to have them on the podcast at some point. I promise osteofiber. They've been reaching out for me. I'll get there.
Yeah. I was very excited when I first heard about this company, and I didn't know a whole lot about them. But basically, it's a biointegrative, meaning it's a screw or staples or pins that you can put in to fixate bone. And then what it does, it actually develops into bone. And you'd never have to have them removed. And they even have plates, and they don't have plates yet, but they've done studies on having plates and other things.
What's the material, or is that proprietary? Do we know?
No, I don't even know the ins. It'll be on a website. Yeah.
And we are hearing carbon fiber. We're hearing things about carbon fiber. You've talked about titanium nitride coatings. Any?
Yeah, titanium nitride is more of it's a ceramic type coating. They say it's ceramic. I don't know specifically on all that. Yeah, it's just ceramic coating. That says titanium in it. Yeah. And the nitride, so in the tooth implants, there's the implants, the dental implants. There's zirconium, which is a metal, but zirconia is the ceramic. And and there's a chemical conversion. It's very difficult to try to, process all that. But yeah, then there's carbon fiber. There's you've heard of PEEK.
I have heard of PEEK. Unfortunately, when I encounter PEEK, it's in regards usually to spinal surgery. I had a PEEK cage and it did not heal.
And it's not good. Yeah, I mean, everybody's different, but now there is PEK,
which is
PEKK.
Okay.
Yeah, and supposedly it's less reactive than the PEEK, and more tolerated and more integrative as far as that goes. And at least in certain studies, they've had less reactions to the PEK cages and other things that apparently they have. And I think they're working on other types of devices that are coming about. I don't know a whole lot about them. I heard about them not too long ago. And so
I'd sure like to see a cardiac or vascular stent that was non-metal.
And I just don't know enough about them, but I know they have coatings and everything. But that
nitinol stuff scares me.
I know. Yeah. Nitinol, especially with the high concentration of nickel, 50%-ish nickel.
Just kill me. I'm sorry. Yeah. Take me off the planet. I don't want that.
Yeah. We had all the fallopian tube issues, right? With the device.
Thank you. And is there anything before we end that you wanted to bring to the table that I haven't brought up in regards to this?
I think a lot of it is, like I said, just being careful, talking to surgeons. I think and if you're not getting the response you're looking for, go on to another surgeon. It's a pain. It can take time, unfortunately, way longer than you want. But be looking at that. Don't think that the next surgeon you're talking to, just plan on having to go through a number of surgeons to finally find one that you're compatible with and will listen, and then try to remain calm and cool as best you can when speaking to a surgeon, and try to have things laid out the best you can.
I said that was my last question, but I have a bonus question. Would a list of doctors and surgeons willing to remove hardware be something that would be of value for the community?
Oh, always. Yeah, always. And I know I thought I heard like some of the companies that do the testing do have some, or they probably refer them actually on to some of the book pages and that type of thing. And because there's lists and stuff out there, but that's changing all the time too.
And you may have to travel for surgery. I had to travel for all of my surgeries almost.
Mm-hmm. Yep.
Not necessarily.
Yep. And sometimes you do. I had somebody from Kansas fly out to see me in Washington State to remove hardware that the surgeon that put the metal in says you're never going to walk again. And I looked at it and go, the bone's fused just fine. Was it a tougher than heck case? Yeah. 5 hours long. Ugh. 5 hours long to remove this metal. But it was quite complicated. But the patient walked out of there afterwards. And their life was changed. So is it worth having to travel? Yeah, if you find the right person to remove things and you have a good feeling about and all this.
And for me,
I think it's just searching. Yeah. Searching. Yeah.
So it has been for me. So if you have a great doctor or surgeon who is willing to remove hardware and doesn't poo your metal allergy, send it on to the Heavily Metal podcast. I'll start a page. All right. Thank you, Dr. Schroeder, for coming on. I sure appreciate you coming back, and we'll have you back again.
Sounds great. Okay.
Right, thanks.
All right, take care.
I'd like to thank Dr. Scott Schroeder for coming on today to share a little bit more with us about the hardware removal process, the adverse event reporting process, and how we can better advocate to ourselves as patients with metal allergies. I'm just going to make a little plea on behalf of my followers. If you are a physician or you are a surgeon, a few things that my community really needs you to know, and we've touched on them in this episode, but probably the biggest thing is you don't have to have all of your hardware out to experience great relief. Even if you have a ton of other hardware in your body, taking any out can be the difference between life or death for some people. It was for me. I had 10 pieces of lumbar fusion hardware that were removed. 3 still remain. But those 10 pieces that were removed caused a 60% reduction in my pain. I have 2 cervical cages, a lumbar fusion cage, 6 SI joint implants, And I have had 2 surgeries with 4 little titanium plates from a Tarlov cyst surgery and 3 gallbladder clips from a cholecystectomy surgery. You would think that taking those pieces of metal out would do nothing to improve my health. Let me tell you, they saved my life. My hair stopped falling out immediately. I stopped breaking out in hives immediately. I stopped having massive systemic chronic pain that kept me on the couch for days and hours on end. It made a difference, even in spite of the other big metal in my body. And it wasn't placebo. It was measurable, not once, but twice. So please help your patients out by removing what you can and what's safe to remove, and helping us champion our cause for non-metal implants. But also still, that doesn't let you off the hook to know the symptoms of a foreign body reaction and to consider that just removing the foreign body removes the insult to the immune system. One of my favorite surgeons, Dr. Solomon Azouz, has said that you weren't born with metal in your body. You should just be able to have it out because you asked to have it out if it is safe to do so and if it's in the soft tissue. Your immune system knows when something's not supposed to be there. It's going to mount an inflammatory response. Doctors and surgeons, why are you surprised about this? Please trust us. Help us achieve a better quality of life. Do no harm. Help join us on the bandwagon and help advocate better for your patients. Don't do the surgery right away if there's a better way. If you think your patient might react to this hardware, then put off surgery for a while. Watch a little longer. Maybe do some pre-screening, some compatibility testing. Check them for metal hypersensitivity beforehand. How many of you don't know that a lymphocyte transformation test is the best indicator of a type 4 delayed hypersensitivity reaction? Patch testing and external testing isn't always perfect in regards to what happens inside the body. What happens externally doesn't always happen internally. I know patients that are sensitive to nickel that are fine with a titanium implant, but there are many who are not. And it's just a bigger conversation and a better dialogue that we need to be having. We want you on our team. We want to feel better, and we want you to help us feel better. So I'm not anti-doctor or anti-medicine, and neither are my followers or listeners. We just want it done with greater care and with more options and more dialogue and less gaslighting. I'm going to put the link to filing the adverse event report in the show notes. I'm going to put the link to my website that has a petition you can sign to urge providers and hospitals and medical facilities to screen patients ahead of time for metal hypersensitivity. We need to do compatibility screening. We need more implants that are compatible with our body type. And again, please don't misunderstand me. I am not saying don't have surgery. I'm saying surgery is always risk versus benefit, and providers and patients need to be on the same team to know that adverse events happen, reactions happen, allergies happen. When is it important to have this surgery, and when is it important to wait? When is it important to try another conservative method? When is it important to have the discussion about removal of hardware? I would say when you are discussing having it put in. As the famous Dr. Julio Novoa said, a good surgeon can put in hardware. An excellent surgeon can remove it. And these are just such important things because people are suffering and dying, and doctors need to realize that there is trace nickel in commercially pure titanium. And if you are metal sensitive, you could likely be sensitive to one of the other alloys. It's really important to have the dialogues about hardware removal and adverse event reporting and what to look for. If you start reacting, having GI symptoms after a lumbar fusion surgery like I did, I was eating an anti-inflammatory diet that was super high in nickel. And because my bucket with nickel was so full from the implant, it was overflowing the bucket. I was reacting systemically to the nickel in the food. And as soon as I took that out, my pain got better. I would have liked to have known that the month after my surgery. Again, there's so much more we can do here to do better. Please like, share, subscribe, and share this with people you know who may be suffering the effects of metal allergies. And thanks for all of you in my community for being part of the effort to stand up and tell the medical community that we're not going to take this anymore. Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware, and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.